I'm Katie Morgan, and I work at MUSC in Charleston, South Carolina, and I'm a hepatopancreatobiliary surgeon, and I specialize in pancreatic cancer and pancreatitis. Pancreatitis is a disorder of the pancreas that is non-cancerous, that involves inflammation of the pancreas and irritation of the pancreas, and is marked really by abdominal pain mostly. Pain in pancreatitis comes from multiple different sources and is very different dependent on the patient. In some patients, it's because of a blockage of the pancreas duct where the pressure builds up and causes pain for patients. In other patients, the pain is caused by the inflammation causing irritation of the nerves around the pancreas. And it can be very complicated and hard to manage. There are a lot of different causes for pancreatitis. Historically, we felt that the majority of cases of pancreatitis were caused by alcohol, but what we realize now is that there are many other causes for pancreatitis, including smoking, and in 10 to 20% of patients it's caused by a hereditary or a genetic cause and can be passed down through families. So genetic causes of pancreatitis, as we're realizing more and more nowadays, come from genetic mutations, and there's not a specific way to prevent anything with that. There's certainly things you can do to decrease your chances of having problems with pancreatitis. Most specifically, if you do have pancreatitis in your family, it's important to not smoke. So pancreatitis can cause abdominal pain. That's the number one problem with pancreatitis. It can cause problems with a blockage of either the pancreas duct itself. It can cause a problem with blockage of the bile duct or sometimes of the small intestine. One of the long-term complications of pancreatitis is the development of diabetes or of what's called exocrine pancreatic insufficiency, which is where the pancreas doesn't make enough of the digestive enzymes to help you digest your food. And so in the long term, patients with pancreatitis can have nutritional problems where they lose weight and aren't as healthy as they should be. The most important treatments for pancreatitis are taking care of the symptoms, so taking care of patients' pain and making sure that they are healthy in terms of their nutrition and their weight, making sure that their diabetes is under control. In patients with continued pain, we often can do interventions such as endoscopic treatments with stents or other endoscopic interventions. And in many patients, we do have different surgeries that we can perform to help people feel better from their pain. So there are certain kinds of doctors that specialize in the management of pancreatitis. There are gastroenterologists that have specialty in this, and then there are surgeons that have expertise in this as well. So it's always important to start with a primary care doctor who knows you well and can take care of you in a comprehensive way, take care of all of your problems, and to ask for a referral to an expert in pancreatitis. Patients with pancreatitis often will have limitations in how they are able to interact in the community and the world because of their pain. And so it's important as a patient's life becomes limited by their pain and by their medical needs that they seek out healthcare to help themselves feel better. Pancreatitis is a chronic disorder that is really not something that is perfectly cured. It's not like a tumor that's able to be removed. It's a chronic condition. And so many of the therapies that we have are aimed at trying to make these problems better. And so we're often able to make people's quality of life better, but we typically do not cure people of pancreatitis. The goal of many of our interventions with pancreatitis is to help people to feel normal again. We want to improve quality of life, and often when we look at our different interventions, that's the number one goal that we have, is looking to help people feel better and have a better quality of life. There are different healthcare providers that have an interest and expertise in pancreatitis, and so it's important to choose a healthcare provider that has that experience, that interest, And so it's important to find out if your healthcare provider does have particular expertise in pancreatitis. Often when patients first come in to see us for their pancreatitis, they have seen many different physicians and are disappointed and frustrated by the healthcare encounters that they've had. And so it's important to find a healthcare provider that's an advocate for patients with pancreatitis and is well-versed in all the different opportunities for therapy that patients have with pancreatitis. The hard thing about pancreatitis is that it is a long disease process and a challenging disease process to get better from. And so there's not a quick fix, and it can take a long time. Now, realistically, there's optimism in this, and that there is an opportunity to live a long and very healthy and happy life, but it can take a while to get to that place. It's very hard for patients when they come to us and they've been frustrated by their other encounters to understand that there is a light at the end of the tunnel and that there are good opportunities for a better life down the road. But it's important for patients to kind of hang in and to be patient and to understand that down the road they will feel better. And this isn't necessarily the end of the road for them, but there are many opportunities for them to feel better.